And I'm so happy to be hosting the employee-focused strategic plan discussion session. I think we've got about 86 folks registered for the webinar, and I think at least in some cases there are multiple individuals. So I'm thinking we've got somewhere in the neighborhood of 80 to 100 employees from around the state involved in this webinar. I'm going to ask Jess Harvitt, who's here from the communications team, to kind of walk through the technological issues briefly, and then we'll get started.
All right, everyone, you have two different ways to listen to this. So you're either listening to us right now through your computer speakers or through the conference call dial-in number. If either of you are either side are having any troubles with the audio portion of it, please just send us a message in the questions section. And the questions section is also going to give you an opportunity to ask various things throughout the presentation. To kind of keep things moving along, we'll ask that you submit your questions that way if possible throughout Nikki's presentation. And then once we get to the end, we'll do a Q&A where you can unmute your phones and go that route as well. So if you're on the conference call line, please unmute your phone. Otherwise, here's Nikki.
Great. Thanks, Jess. So we've got just a little bit less than an hour now. And what I'd like to do with this time is just really give you an update of what we're doing in the department in terms of strategic planning. We'll talk about some of our major accomplishments over the past year, some initiatives that where we're headed in the upcoming year. But then for the bulk of our time, I'd really like to hear from you, and as Jess conveyed, we'll do that through the questions box on your form, to solicit your feedback and have a conversation about ways that the Colorado Department of Human Services can be an even better agency. So I'm going to go ahead and start in on the PowerPoint, which I think you can all see on your screens. Go ahead, just let me put this meeting in context. The Governor's Office, Office of Policy and Budget, requires that each agency submit a strategic plan as part of its budget submission. So we have to do strategic planning. What we don't have to do is what we have done last year and what we're doing now, which is a pretty massive outreach effort. Last year we visited 7 sites around the county, around the state, to solicit feedback from all of our stakeholders. We also had 2 employee engagement sessions and then posted our draft strategic plan online and did a survey to solicit feedback. We liked that so well and found the input we got so valuable that this year we've basically doubled that effort. We've had 14 strategic planning outreach sessions around the state. And this year we're employing this technology, this webinar, in order to hear from all employees who choose to participate. For those who can't sit in on a webinar or choose not to, we'll be sending an email with a Survey Monkey tool to solicit feedback. And for those who don't have computer access or don't have easy computer access, we're making print copies of the survey available as well. So we are really doing a massive outreach and engagement effort, which is time-intensive, but we feel very strongly that there's no better way for us to get a strategic plan right than to hear from all of our stakeholders, including, very importantly, our employees. So since we did our outreach sessions last year, we have a number of accomplishments. We did some massive work related to the CBMS system, which was a bit of a coup, and we were able to, through a good communication and combined effort with other agencies, ask for and be granted by the legislature some significant dollars to invest in CBMS to keep that system strong and make some important repairs. This year we also unveiled, with the governor's support, a 3-year child welfare plan, which brings about 5 kind of categories of changes and improvements to our child welfare system. We also stabilized CHATS, another IT system. This is one that child care providers use for reimbursements. It had some very important deficits, and we were able to stabilize those, and we're seeing big improvements in that. These are items that come out of information that we heard from employees and out on the road. If we hadn't done the strategic planning outreach sessions last year, I don't think we would have had a sense of the difficulty folks were having with the chat system. We were able to put some fixes in as a result of those conversations. We've also implemented CSTAT, a performance management approach in the department that identifies performance measures and outcomes for each of our program areas. Recently, the governor issued an executive order that creates what's called the Office of Community Living in our partner agency, HCPUF, and also brings together a group effort to identify ways that we can cooperate better with HCPUF to better serve folks with developmental disabilities and folks in the aging communities in Colorado. Also, the governor issued an executive order in June this year that established an Office of Early Childhood here within DHS that brings together disparate programs that serve the early childhood period. I went through previously, we have to do a strategic plan because OSPB says we do, but more importantly, we do it because it reflects the values that we have as an administration and as an agency. Things like we are transparent and we share what we do. We believe in the greatest degree of openness possible so that we can hear and share and do better work together. We're also held accountable to what we commit to in our strategic plan, which is appropriate. We don't want to make commitments in writing and then not follow through on them. So we take the strategic planning effort very seriously, which again is why we're doing such a big outreach effort. What you see now is our org chart with a few changes highlighted. You see on the right-hand side the Office of Early Childhood created with 2 divisions. I mentioned that as a success in the last year. We've done that, and we're doing the hiring of management positions to provide leadership to that office in those 2 divisions. On the left-hand side, you see highlighted county services. This reflects a new way of supporting our county partners. It's a rework of what we've previously had as field administration, but the intention is that we provide more flexible, agile supports to our county partners so that they can get the support and guidance that they need, and so that we can also facilitate better our county partners getting the right contacts within the other offices and divisions in our department. Last year, we asked we asked all these 6 questions on our strategic planning outreach sessions, and we then followed up by hosting an employee survey. It was actually the governor's office put out an employee survey called the Employee Engagement Survey. And we heard from many, many, many employments. In fact, many of you probably are rolling your eyes remembering the amount of haranguing and nagging that you were subject to as we encouraged as many employees as possible to participate in that. But we take the results of those surveys very seriously. Some of the things that we as an agency have done in the last year to respond to what we've learned from employees include pretty tremendous reworking and growing of communications focus and efforts in the department. We now are producing a monthly newsletter that's distributed by email. We have a monthly video that goes on the CDHS YouTube channel in which our director, Reggie Bika, speaks about issues that are of high priority to the department, recognizes groups and individual employees who have gone above and beyond, and so forth. Thank you. We've also recently unveiled a department Facebook page. We have a Twitter account that we used this summer and found very useful as we were helping coordinate responses to the fires this summer. And what we're experiencing right now, a webinar. It's somewhat new technology for our department, but we're using it in most or all of our offices and getting some really positive feedback about this approach as a higher tech way to communicate better in a way that doesn't require our employees and partners around the state to hop in a car every time we want to have a meeting. We also created in the last year an employee council, which has representatives from different levels in the organization and every division and office that pulls together employees to identify priority areas of improvement and respond to potential approaches or changes that come from the executive management team. And so forth. That group meets roughly monthly, about every 4 to 6 weeks, and has identified 4 areas of priority for the upcoming months. One is employee recognition. The Employee Council met just this morning, actually, and spent a good amount of time identifying the importance of employee recognition, strategies and approaches that may be useful, and is planning to communicate to the executive management team with their advice about ways that, as an agency, we can demonstrate greater support of employees and recognize their significant contributions. The Employee Council is also focused on streamlining paperwork. We're doing a lean event related to what we call the clearance process, which we're hoping will reduce the time it takes to get approvals for things like travel and grants and so on. We also heard today, we invited a guest from RTD talking about the EcoPass, which is an option that can be pretty cost effective and allow employees and enable employees to better use transit, and in some cases can be a real cost saving for employees. The fourth item, there's not a bullet on this slide, but that we'll focus on in upcoming months, has to do with training and advancement opportunities, which is something we heard in the engagement survey last year was an area of real importance and one we need to develop improvements on. So expect to see more and hear more about those items in upcoming months. A couple of other things that come out of the employee engagement survey. The para contribution increase came out of the governor's budget because he heard loud and clear that in an absence of raises, that's an important financial factor for employees. We were also able, as an agency, through really concerted efforts to communicate effectively to the Joint Budget Committee and the legislature the impact of any reduction to the personnel line in our budget, particularly with respect to our 24/7 facilities, that you can't cut the salary lines there without dramatically impacting the safety of our clients and patients and staff. And through that communication effort, we're able to exempt our 24/7 facilities from the 1% across the board reduction that all other agencies were subject to. The 6 strategic initiatives that we identified out of the strategic plan last year are listed here on the screen. The integration of early childhood services and funding is reflected in our new office. The efforts under long-term care redesign I described with the new office created in HCPUF and a number of efforts related to that. Streamlining, many of you were involved with the rule reduction exercise over the last year, in which we eliminated about 20%, I think, of the rules that we have our state board folks approve. We're continuing those streamlining efforts in reducing, for example, agency letters. We're undertaking, with the support of the Employee Council, a similar effort related to reducing policies in the department. The idea is that rather than write a bunch of stuff down that doesn't need to be written down, we can have things like webinars and technical assistance to communicate instead of everything being a top-down communication. And as I mentioned, we're working to streamline the clearance process so that we can just get some improved efficiencies in the department. Another initiative relates to the Economic Security Plan, which links efforts out of our Office of Economic Security with the governor's called-out a blueprint having to do with employment strategies for the state. I described previously the child welfare strategies in the governor's plan. An important aspect of that is an outcome-focused orientation in child welfare, which leads to the last initiative here, our STAT strategy, which we call CSTAT. In all parts of the department, we're finding that a useful tool to identify the outcomes that matter the most to the people we serve and our efforts to improve those outcomes. I'm going to actually not pause right here. I'm going to walk through this slide and then pause to see if there are any questions. So if you're thinking of questions on anything I've shared so far, go ahead and submit those questions. We'll pause for a minute to respond to those and then move forward with the rest of the presentation. What you see on the slide here are our updated mission, vision, and value statements that really reflect conversations that we had around the state and with employees in the last year, and statements that really, I think, reflect what it is we're trying to do as an organization, which has really become the most effective 21st century human services system. So you see here the mission, vision, and value statements, which we're hoping to unveil in upcoming months as a approach to communicate to one another and to our partners what we're about and the commitments that we make to one another. I'm going to leave that up on the screen while I pause for a moment to see if any questions have come in on anything that I've shared so far. So you'll hear quiet while we're reading any questions that have come through.
We did have one question about whether we will know who asked the questions. Some people are interested in remaining anonymous or providing feedback in a different way. Will that be a possibility?
Yes, we'll do a Survey Monkey tool that will be announced by email. That's online and will be anonymous, as well as paper surveys. I don't have another venue for providing feedback for this conversation, though. Another question has come through about will CSTAT data be made public? The answer is yes. An important part of the CSTAT strategy is transparency and making available to the whole world information that's unspun, but that's our true data, kind of warts and all, about how we're doing in terms of our performance. The first CSTAT summary report is going to be published on our website, we think early next week. Moving forward, we expect there to be a quarterly CSTAT summary report that shows every single performance measure we're tracking in CSTAT and a graph that shows how we're doing. And we think that's an important part of how we do CSTAT, is to do it openly and publicly. Next question, is there any measurable data from last year's strategic plan? To the extent that our initiatives are linked with performance measures, such as those that we measure in CSTAT, I would say yes. In fact, one of the things that I'm most proud of in this department is that we do link our initiatives with outcomes that matter to people, and we measure them through the CSTAT process. So for those of you who are interested, I would talk with your office directors about looking at your CSTAT measures. And for an agency-wide view, you can look at the summary report that will be released next week. Question about will we be able to have the slides? I think that question means the slides that are in this PowerPoint. I believe that we are going to be sending the PowerPoint out to all employees, so I think the answer to that is yes. In the surveys, the electronic survey and the paper survey, we're going to have kind of a condensed version so someone doesn't have to read through 30 slides before they answer the questions, so that you can get the whole version or a condensed version. And that's it for questions that we've got so far, so I'm going to continue moving along. I'm going to go just briefly through the next slides, which provide more information about the particular initiatives. And in particular, I'm going to focus on what's on the right-hand side of the screen, which is what's coming up. So with the first initiative related to early childhood, as you know, we've created a new office. We are going to continue our positive working relationship with the Department of Education. In the next couple of months, as a state, we'll be applying for the Early Learning Challenge grant. That's part of the Race to the Top federal funding. The Lieutenant Governor's Office is coordinating that and we're a key player in the development of that. Also working on universal application for all childhood services. And then really building on the collaboration that we undertook in the last year with the entities outside of CDHS that are critical to providing services in the early childhood period. In terms of long-term care redesign, we're developing 6, 12, and 18-month work plans that really speak to aligning that new Office of Community Living with the advisory group that was also formed by executive order to provide counsel on best ways to support the developmental disability community in Colorado. And then, you know, the goal moving forward is that we're reducing this department's role in administering long-term care services and supports, and instead enabling HCPF to take sole lead in the oversight. We've got, we think, too many layers and levels creating unnecessary bureaucracy. And we think by collaborating with HCPF better and better enabling HCPF to be the lead role, we'll get better outcomes for the folks that we serve. In terms of streamlining, I talked about the rule repeals that we focused on. In the next 18 months, we're planning to revise over 2,000 rules that staff identified as needing updating, either because information is out of date or modifications need to be made for various reasons. We are continuing work to develop a really careful review process to avoid unnecessary duplication. We've heard from a lot of folks, our community and provider partners, that one part of your rules is telling me to do X, but a different part is telling me to do Y, and we think that we can do a better job of streamlining those. We have undertaken a lean review effort related to rulemaking to make that whole process easier. And as I said, we're reviewing agency letters and then also CDHS policies to really pare down to the most necessary rules and policies. In economic security, we are continuing to work with the Governor's Office and HCPF to continue work on the CBMS plan. We're increasing support to kids through the Child Support Program. Mostly this has to do with creating and identifying and connecting non-custodial parents with employment opportunities, because we know and research says that kids are best supported if they've got two parents who are active, supportive parents in their lives. We think as an agency and as a state we can do a better job of helping non-custodial parents support their families better. We're also pursuing what are called two-generation strategies to reducing and eliminating poverty. It's essentially, rather than having efforts on that focus specifically on parents, be separate from our efforts that support children, that we connect those efforts and support whole families in their efforts to get out of poverty. In child welfare, we're undertaking the child welfare plan I talked about. An important component of that is improving and enhancing our training academy and training efforts to train more folks. So instead of just child welfare workers, also their supervisors, directors, foster parents, and so on. We have developed a leadership council as part of child welfare improvements so that we can better interact with the public and partners about improvements in the child welfare system. We are continuing to pay attention to the Division of Youth Corrections as a critical component of the child welfare world in Colorado, and making sure that we're serving kids in the right time, in the right place to support them and their development. And in the child welfare world, the Colorado practice model is continuing its expansion with the goal of being statewide by 2014 and 15. We've implemented the STAT strategy we said we would, and upcoming steps on that are sharing performance data publicly. I mentioned the upcoming summary report. We're also working to identify ways to provide data to, for example, counties more in real time, so that counties can see their monthly performance data as easily as we in the state can, which is not to say that it's an easy process so far, but we do need the folks who are in the best position to influence the data, to see the data and get support around improving it. We're also identifying some increased capacity within our agency to support counties around CSTAT, to provide some technical assistance and some support to them as they grapple with difficult performance management issues. And continuing to involve counties and other partner agencies to break data down to the appropriate level, and not have the CSTAT process be a gotcha or to embarrass any entity that's having difficulty, but really to provide a support and share learning and best practices. And here's more information about STAT, which I think I've already covered, but isn't that a pretty logo? Some initiatives that have come up in the last year that weren't initially identified as part of the strategic plan. In adult protective services, we're coordinating with other entities that can provide supports related to adult protection. There was legislation called SB 1278, which creates an elder abuse task force to grapple with issues related to adult protection, and you can see the areas of focus there. We're also focusing on our regional centers that provide services to adults with developmental disabilities. Across the department, we're really looking to ensure that anyone in our physical care is receiving the right services at the right time. That's true for youth corrections, that's true for our mental health institutes, and it's true for our regional centers too. We're very committed to deinstitutionalization of folks being served in their local communities to the extent that is possible and healthy for them. In the regional center context, and I'm sorry for not advancing that slide, in the regional center context, we're looking at the services provided by the regional centers and the length of wait lists that there are for folks to get into the centers, and figuring out ways we can enhance or develop community capacity to better serve folks in the right time and in the right way. And to the extent that an individual needs service in an institutional capacity, that service is not, that they're not in that institution one day longer than they need to be. In our mental health institutes, similar efforts. The third bullet here speaks to this same concept of identifying the barriers that exist that are keeping folks from discharging from the psychiatric hospitals when they're medically ready to discharge. We know that we've got to work with communities better to better support folks leaving the institutions. Also in the mental health institutes, we've had a big focus on reducing the time it takes for those who are waiting for competency evaluations. They're typically waiting in jails. We think that they should get those evaluations just as soon as possible so that they can get the services they need as soon as possible. And we've set some specific targets around that. Within the mental health institutes and also other parts of the department, we're developing trauma-informed care approaches, which is a philosophy and I think a set of strategies related to understanding and acknowledging the trauma that patients and residents have experienced in their lives that precipitates some of the behavioral challenges they're having. It really is sort of a change in philosophy that evidence shows and that we also believe will result in better care for the folks in our facilities. All right, we are at the part of our time together. We've got about a half hour. What I'd like to do is ask you to think about responses to these questions. We'll have some ability for you to respond in this webinar by typing your responses in the questions field, and we'll read those to share those with you. But also encourage you to continue your thinking on these items, and if you choose to participate in the SurveyMonkey or the paper survey to the extent that you would like to. But some other questions have come in that I'm going to just take a look at before I pose new questions to you. Hold on while we do that. Where are we, Jess? Okay, question is, where can I find information about what resources and training will be available to those providing mental health services, knowing the importance of implementing a recovery model as soon as possible? I'm not sure I totally understand the question. It sounds like this employee also has another question. Give me just 1 second to read it and see if these questions are linked. I'm going to link these two questions together. Second question is, will the state release a specific plan for implementing mental health recovery and also Colorado's Olmstead plan? I understand that all my questions and concerns may not be able to be addressed, but this is what is important to me as a mental health RN. So thank you for those questions. I think you're right that I can't go into a great deal of detail in this, but what I can do is log these questions to ensure that we take your feedback into consideration as we're developing the strategic plan. What I'm hearing is that it's very important for us to be thoughtful and do some deliberate planning related to mental health recovery issues in Colorado. Another question that has come in, will this year's plan include the varying offices and departments of CDHS? I think this question reflects that in the last plan, we didn't have a specific stated initiative for every single part of our department. And I don't know to what extent every division or office will be specifically identified in the strategic plan. Certainly we do more than any 5 or 6 initiatives as a department. We try to put into the strategic plan those items which rise to the level of our communication with our partners, with the legislature, and so on. So this is, of course, just a partial list of the good work that's happening. And I assume that we'll have strategic initiatives that speak to all parts of the department, but I won't guarantee that every single department will be named and sort of see their efforts in that plan, since it is, we do have to condense it and not reflect 100% of our good work. Next question. My hope is that Reggie Bika, oh, okay, sorry, that was a follow-up on another one. So here's a separate question. When will the relocation of staff to HCPF occur? Can you discuss all proposed timelines? I can't give any details, and the reason is because the advisory body that is called, I always have to check, but it's in this presentation. The Community Living Advisory Group and HCPF's Long-Term Services and Supports Advisory Committee. Those two groups are really working out recommendations on the logistics. So I would say stay tuned for those. I think that the first group hasn't met yet, has a meeting within the next few weeks. So it'll be in upcoming months that those kinds of details are identified. Is it possible this next year to identify strategies or objectives that blend over to all offices and departments to fulfill and measure, rather than limiting the focus to individual departments? Follow-up from a previous question, I think the answer is we'll as a department, do our best to make those connections. The strategic plan is a guiding document, and we identify through our CSTAP process the measures that link to our strategic plan. So through the STAP process, we make our strategic plan real and active, and we do have every division reflected in the CSTAP process. So those connections are ones that we readily make. And Jess is pointing at another question. Under Need Your Help, is CDHS and HCPF utilizing a lean coordinator in the transition of the state unit on aging to HCPF? I really like that question. I don't think right now we have a particular lean coordinator that's connected with those efforts. We do have folks who have had lean training in many, if not most, parts of our department, and are working on what are some ways that as a department we can further champion lean efforts and initiatives. And I think that's just a very logical connection to make. So I'll take that contribution and be sure that we follow up on it. Okay, great. So what I'd like to do now is invite you to provide some input on question 1 here, which is what can we do better, more, or less of that will help us achieve the goal of being the most effective 21st century human services department in the country. So go ahead and type in your contributions, and I'll read those as they come through. What can we do more of? What could we do less of or eliminate altogether? I see a contribution here that we could do more lean events, which I would absolutely endorse. Just at the executive management team yesterday, we talked about some routes to further deploy lean training and lean initiatives to do that. Another suggestion has come through to hire full-time lean facilitators. We do have the capacity to use some existing contracts that the governor's office has facilitated for agencies. And at the same time, we're looking at if we can identify some resources to provide a lean coordinator or facilitator role within CDHS. So thank you for that suggestion. Another suggestion, continue to communicate with employees and increase information provided. Absolutely, I appreciate that very much. I think we've done an awful lot in the communications world. We've started creating a monthly newsletter by email. We're sending out a CDHS daily email, which is a synthesis and provides links to news media stories that affect or are of interest to various parts of our department. We've got considerable work in the communications realm related to dramatically improving our internet and also developing, or I guess bringing back from the dead, the department intranet, which we think will be an important tool and way to improve communications among staff. I mentioned we've got Facebook and Twitter pages, and that our executive director is doing a monthly video that we hope all employees will have the opportunity to review. If you've got specific suggestions about particular ways that it would be more helpful for you to be communicated with, or those colleagues of yours who maybe aren't on the webinar, I'd invite you to contribute those now or follow up on the survey and share those specific ideas. Our appetite for improving communication is tremendous. Suggestion, weaving PMPI components through all departments. If that person can spell out what PMPI is, that would help. I'm going to move on to the next question and wait and see if I get a response there. Suggestion is to lean the clearance process. It is not in alignment with the lean principles. Absolutely, and that's an effort that we've already got underway. We are identifying a lean facilitator who can bring together folks from all parts of our department into what's called a rapid improvement event, which will be a 3 or 4 day, we think, effort, identifying ways to streamline the clearance process. So thank you for that contribution. Okay, so the suggestion of weaving PMPI components through all departments, the clarification I've got there is performance improvement measures. Absolutely. Through the CSTAT process, we've got measures identified for all of our divisions and many subunits below the division level, and I think that's absolutely consistent with what we're trying to do. If there are particular performance measures that are of interest to you, I'd invite you to share them with your managers, and we'll consider whether they belong in CSTAT or are better managed at the local level. Suggestion, train supervisors in management practices that motivate employees. I love this suggestion. I think that we do not have a mandatory supervisor training at all in this department. Some components of the department are better than others at training supervisors, but as an agency, I see this as an area where we need significant improvement. And I would just add to that suggestion that in addition to motivating employees, we've got recognizing employees, dealing with performance issues, and there are many aspects of being an effective supervisor I think we can provide some better training around. Point again, Jess, where are we? Okay, many of our employees do not have computer access, but more have smartphones or other media types. Yep, that's absolutely true. We're trying to use social media and other IT type of resources to communicate with our staff better. You know, so if we've got staff who don't have computer access as part of their job, they don't need or use emails, I think that we're working hard to figure out ways to communicate better with all of them, and this reminder about most folks having smartphones or other media is helpful. Question, can anyone attend a CSTAT session? I would say that my answer is kind of mixed. I would say check with your supervisors. We have a lot of folks attending CSTAT sessions, and you don't need a special invitation. When we have outside visitors, we try to know who they are ahead of time so that we can acknowledge them and so that we don't crowd out our own employees. But if you're interested in attending a CSTAT session, I would say talk with your supervisor. That should probably be fine. Okay, in terms of number 4, I think that means, okay. So I think I'm now getting suggestions in response to any of the 5 questions that are on your screen. So go ahead and do that. This one is related to question number 4. I would make this the best place to work, and we would have the reputation that coming here would be a way to grow and serve Coloradans. I have heard many times that we cannot receive raises, and I totally understand. However, I continue to see people getting promoted or new jobs come up all of a sudden for a certain person. This hacks away morale for some employees, and just being more transparent would be refreshing and encouraging. That's a terrific suggestion. You're right on the raises front. This budget didn't include raises. I'm optimistic that upcoming budgets at the state level will, as we think, knock wood, cross fingers, etc., that the budget picture in Colorado is improving. And I know that it's a priority I've heard the governor speak about. But you're right, we don't have raises in the meantime, and it is dispiriting or demoralizing when you see things that aren't transparent and look like someone's getting preferential treatment. This upcoming year, Human Resources is undertaking a look at classifications in the department. So is a GP3 in one part of the department doing roughly comparable work to a GP3 in another part of the department? We think by looking into those kinds of things, we'll get a good lens into if we've got inequity or other kinds of problems. A suggestion here related to that says empowerment of employees. And then follows up by saying employees don't feel they have a voice. I think what we're doing a lot in the communication world to encourage that. My email address and our director's email address are open to all employees, and our commitment and value is that this is an open, communicative place to work. So keep at it. Participate in surveys. Respond to the video messages. And so forth. But our real goal is to listen to all employees. Question, will the governor be speaking to CDHS employees? He has been to OIT and HICPUF twice. Good question. I don't know. We don't have anything particular planned for the governor to speak to employees, though he has been to the Wheat Ridge Regional Center and maybe other site visits that aren't coming to my mind off the top of my head. Did he do the nursing home visits last year?
Reggie?
Yeah.
Yes.
No, the governor.
Oh, the governor.
Liz McDonough, our communications director, is in the room with me. She's helping me remember.
He did. The governor visited, I think, Fitzsimmons last year.
Yep, the governor visited the Fitzsimmons nursing home.
And that's it, I think.
Those are the ones that come to our mind. We've got a very positive working relationship with the governor. His chief of staff, Roxanne White, is a dyed-in-the-wool human services person, and she and the governor are both very sensitive to the issues of human services. So we're lucky to have a good ear in the governor's office, and we'll look for opportunities to invite them to the department. Will we ever see 10% salary raise with promotions? I can't predict the future. The current practice is if an employee is promoted, they can, through the office director's authority, get a 5% increase. We didn't get a budget increase that allows us to grow salaries in any way, so we have to manage to very, 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 very tight staff budgets. I would just remind you that in the now current budget, our 24/7s were exempted from salary reductions, which is what every other part of the state system experienced. So I would hope so, and we advocate for salary raises. It's not in this budget, but we'll see. Question, how specifically is Colorado's budget improving? Every year, maybe even quarterly, the governor's office, budget office, develops revenue projections, which is essentially a forward look at the revenue streams, the income streams that come into state government. Property taxes, for example, fees, the variety of ways that the state receives money. The revenue projections over the last several years, maybe since 2007 or so, have been downward. So we've had mid-year revenue projections that were worse and worse and worse and worse and worse. The last 1 or 2 revenue projections for Colorado are, for the first time in many years, positive. So we think that there is, at least for the and kind of an immediate term, and Liz has just provided me that we've had forecasted March, June, September. Yep, she's confirming they're done quarterly, and the last, in March and June, they were positive. They were upward projections. So I won't go into the details of what revenue is counted exactly, but we've had specific positive projections coming out of the governor's budget shop. Encourage a culture, this is another suggestion, encourage a culture of lifelong learning by allowing employees to attend pertinent training and conferences that support best practices. Absolutely, that's a wonderful suggestion. There are budget constraints for training, but one of the things that the HR shop is doing in the upcoming year is creating, I don't know exactly what we'll call it, a warehouse or library or something, of free and cheap training opportunities that employees may have access to, so that we can encourage training at all levels. Someone has said, we've been told that we cannot email you directly by our supervisor. I would take that up with your supervisor. You can email me and CC your supervisor. I missed your introduction. Can you please identify yourself again? I'm Nikki Hatch, the Deputy Executive Director of Operations for the department. Next suggestion, it would be good to have meetings by department with our director. I think maybe you're suggesting having the executive director attend your meetings. I'll take that suggestion forward. If I've misinterpreted that, go ahead and clarify. But Reggie and my colleague Dee Martinez and I are more than happy to and really look forward to opportunities to meet with staff. So we'd be thrilled to attend meetings. Okay, next contribution. If I was executive director, I would look to models of trauma-informed care, such as Recovery Innovations in Arizona. They've eliminated seclusion and restraints. They are proving that real mental health recovery is possible and realistic. People once considered chronically mentally ill are getting back to work and getting their lives back rather than becoming permanent mental health patients. It is very inspiring. I would just second that by saying I also am deeply inspired by trauma-informed care. I think there's tremendous potential in our mental health system, also in our regional centers and also our youth corrections facilities, and that also trauma-informed care can shed light in really all the aspects of our work. You know, somebody who comes to a county services center in need of financial assistance probably has also experienced some traumatic incidents that inform his or her position. So I think as an entire human services system, the kind of inculcation of trauma-informed care will be a big step forward for us. Okay, it says, another suggestion says, post all CDHS vacancies rather than pre-selections. Not totally sure what this means. We do send an email out every day that shows vacancies. That includes those that are open to the public as well as lateral transfers. So to my knowledge, all of our vacancies are distributed in that email and posted on our the NeoGov website. And another question here. What other employee incentive rewards are the department offering since there is no budget for salary increases? There's also no budget for any other financial incentive or rewards, but under the guidance of the Employee Council, we're looking at creating a toolkit, as I said earlier, that would provide for supervisors and managers sort of a menu of strategies that are free and cheap, you know, kind of low-cost ways to recognize employees' contributions, and so look for that coming forward. But again, there's, we didn't get any money. We were cut less than other departments, and so there's no new money for those kinds of financial rewards. Interestingly, at the Employee Council meeting just before this, when we were talking about employee recognition, when we brainstormed recognition approaches that employees like and that seem to work, I would say maybe 98% of them were free. And so that really developing a culture of valuing employees and recognizing their contributions doesn't take new money. So working on that culture change, I think, is critical. Someone is saying we're not getting any feedback from what CDHS Council is working on. I think that means the Employee Council. I don't recognize the name of this person to know who the Employee Council rep is from that division, but I would suggest that you find out who that is, and if you can't figure it out, email me, and I'll let you know who your person is, so you can get feedback. Okay, I would like to see a resilience initiative in Colorado similar to the Resilience Trumps ACEs project in Washington State. It focuses on tools to minimize the effects of adverse childhood experiences which are significant. Yes, that we're looking at actually, I've heard some programs looking at using the ACEs tool throughout the department. I think it's something that we should be able to take on, and I appreciate that suggestion. Okay, new contribution here. Our office has lost a large number of employees over the last several months, causing huge increases in workload for the remaining staff. There seem to be significant delays in processing new job postings. Can this be investigated and improved? Is it possible to prioritize certain offices or divisions when they are severely understaffed? I'm sorry to hear that this remains a difficulty. The HR folks in maybe 6 or 7 months ago led a lean rapid improvement event with the specific goal of reducing the time it takes to fill vacant positions, and many parts of our department are already feeling a massive improvement in that area. It sounds like there are still difficulties in some parts. HR is working really hard to eliminate all the kind of unnecessary handoffs and approvals and so forth that can slow that process down. They're also looking to do sort of forward-looking projections. So rather than HR starting to work once they know of a vacancy, they are working with managers to anticipate vacancies. So, for example, we know that we hire, and I'm making this number up, 25 new nurses in a 6-month period. Rather than waiting until those nurse vacancies come up, let's have those recruitments ongoing so that we can provide a referral list as soon as the vacancy is anticipated. Okay, we're getting down to just the last few, so if you've got something that's really burning, go ahead and submit it now, and know that you can also add suggestions to the survey. Okay, it's my hope that the formation of the new offices and divisions will enable better collaboration among programs. However, it has been my experience that collaboration requires planning and facilitation. Are there plans that will help to foster the building of collaborative relationships in these new offices and divisions? I would echo that there's almost no problem is solved by moving boxes on an org chart. And it is not enough to create a new office and create a new division or even combine entities into a new division. That alone doesn't result in improvements. What we are building into the creation of the new Office of Early Childcare and those divisions is the expectation that that things are done differently, that it's a meaningful collaboration instead of just a different kind of reflection of programs on a box, on an org chart. So thank you for that. Next question, when can we expect the employee recognition list? The Employee Council, a subgroup of folks, are tasked with in the next couple of months developing some recommendations that I think that the next step will be they'll take that to the executive management team. I would expect that we would respond to, react to, and engage with their recommendations within the next 6 months. Ballpark guess for me, but seems like a pretty good one. Next question. As far as employee retention goes, I would like to point out how difficult it can be to maintain hope as a new employee in an environment with such high burnout. I would suggest that all staff need help to overcome burnout and get their original motivation back, which is to help people. I'm sensitive to that feedback. One of the things that I know to be true from my experience as I've visited sites around the state, but that we also know from the employee engagement survey last year, was that our employees are, I think, #1 compared to all state agencies in terms of their reflection of the belief that their work makes a difference. I think we've got, by and large, employees who are motivated to serve and to help. and that really is the heart and strength of our organization. And if folks are burning out, it depletes that strength. So I'm sensitive to that feedback, and I'm hopeful that our improvements in HR and our communication efforts, improvements related to employee recognition will be really felt at the individual employee level. Last question is, can we get a copy of this PowerPoint presentation? And the answer is yes. And here we are with about 20 seconds left in our hour. I will close by just expressing my deep gratitude to all of you. First, for participating in this webinar and taking the time to sit through and share your thoughts and ask questions. But even more than that, my gratitude for the work that you're doing in the department. A fair amount of it is unsung and unrecognized and happens on the third shift. And I know that we don't, as a state, always recognize the contribution of public sector employees. But I want you to know that I and Reggie and Dee and the other members of the executive management team are aware of and deeply value your contributions. So I'll close with my gratitude and wish you all a wonderful day. Thank you. Okay.